I'm Lana Herteen. I'm the community child advocate with Blank Children's Hospital right here in Des Moines, Iowa. It was such a privilege to be a part of this day and taking a focus on advocacy, particularly with the topic of trauma. You know, I think that oftentimes in the past we've thought of trauma as an isolated incident, which it can be, perhaps, a serious accident, maybe the untimely death of a loved one, or certainly abuse. And any of those would fall into the category of trauma. But really what brain science research has taught us is that actually events that happen in our lives that have a daily impact on us can have a traumatic effect. We've come to refer to that as the impact of toxic stress. And we recognize that a lot of the social determinants of health that impact our children, our families, and therefore our communities really take a toll on our well-being and have actually made our communities ill, sick. And so when we recognize to put the focus on events that can occur on a daily basis, as well as those really big, more obvious traumas, it gives us a more complete definition of what trauma is and the impact that it can have on us. It can affect both their physical well-being as well as their mental, emotional well-being. And again, it's an amazing time to be alive in that the brain science research has taught us that when they looked at brain scans, we actually see a structural difference in the brains of people who have experienced multiple areas of adversity and who have endured long-term trauma or toxic stress. And so we can see where the different pathways are actually formed for folks who have been under those conditions for long periods of time. But the hopeful message that comes with that is that we're also learning that our brains are what are referred to as plastic. And what that means is that they actually can be reshaped, remolded, and that we can learn healthy ways of viewing the world and healthy ways of interacting with the world. And so the efforts that we go to have healthy relationships and to legislate and lobby for priorities within our state really do make a difference. One of the things that's most profound to me is to have learned that even for children who may have experienced multiple areas of adversity, and surely whose brains have developed maybe unhealthy ways of functioning, if they have even just one healthy adult relationship that can buffer the negative effect of the traumas that they've experienced. And so I find that very inspiring because I know it tells me that I as an individual can make a difference, and then collectively when we come together as a group or as a state effort, we can have a tremendously positive impact on the children and families of our state. The other thing I think is important to understand about trauma is that it's a very personal experience. So something that might be traumatic for me may not be traumatic for the next person. And it has a lot to do with the circumstances under which it occurs. Someone who, prior to the trauma, was in a very supportive and healthy environment and had healthy relationships as a part of their daily experience are oftentimes typically in a much better situation than to handle life when a trauma does come down the river. And so that may be unsettling to a person and yet may not have the profound negative effect that it would on the next person who perhaps was not in a particularly supportive environment and therefore is more broadly affected by the experience that they had, the negative experience. Friends, family, community can make a tremendous difference. What we really have learned is that connections matter. As human beings, we are simply wired to connect with one another. In fact, I don't know who to attribute this to, but I remember just giving such pause when I heard someone say that the opposite of trauma is connection. And so our ability to connect with one another to be in relationship with one another, so beyond just a surface level, but to really start to understand and just to even just listen to one another can have a tremendous difference. And I would also add to that it's not just people who are within our inner circle. We can have what you might refer to as like a brief relationship, even with somebody that is a stranger to us that we've never met before. So for example, if I'm, say, shopping at Target and I encounter a mother who has a toddler who has gone into a tantrum, and I know a lot of moms or dads can relate to that story, my reaction to that mother and to that situation can really affect her overall experience of the world. So if I give a compassionate response, which may even just be nonverbal, but just that my face shows that I understand and I offer a message of support, versus the opposite of that, if I cast judgment with my look or I make a discouraging comment, that can really pull away from the effect that mom feels in that interaction. And so we can impact one another both in our very personal and close relationships, but we can also affect each other when it's somebody we don't even really know. We may never even see them again, and yet we can be a positive in their world.